So there's this guy that's in this immense amount of stress, and this guy actually feels he's won the world because he's created something. Not a lot of us create a lot of things, right?
True.
You know, my job would be, you know, do certain things, very pretty well defined. But this is a guy who's always winning. You know, just setting up a company is a victory.
Okay.
Whether it makes a profit or a loss.
Okay.
Right. If I'm going through that, let me say, or if it's a friend of mine, how is that person to know that I'm reaching this breaking point?
Okay.
And what are the kind of preventative? I won't say preventative. I don't really know if there is. I mean, if there is, please educate us.
Definitely.
How does that person know that he's reached the peak and the breaking point?
Okay. So when I told you, one thing is that it could be impulsive, where the person has not made any plans at all. The other thing is that a person, let's say he could be depressed, he could be undergoing under enormous amount of stress, and he's contemplating suicide, he's planning something for suicide. So the first thing is that suicide is not treatable. Once it has happened, it's done.
Yeah.
Okay, the only thing what can be done is that to identify it beforehand it happens, and then to prevent it. There could be certain indicators. Let's say a person is having too much of stress, he's not able to cope with it, and there are recurrent suicidal thoughts which comes into a person's mind. That is one thing which a person can identify in himself. And apart from that, not only the person identifying in himself about the possible suicidal ideations, even many times it happens that the person might not want to act on it. He might not want to seek help.
Right.
Okay.
Because
The reason could be anything.
You know?
The reason could be anything. Because of any reason, the person might not want to seek out help. In that case, it's very important for a close family member, friend, or a colleague to identify certain things which indicates that there is something wrong with this person. The indicators could be like any subtle change in behavior. Let's say a person is going on meeting his friends, relatives. He has a bucket list which is fulfilling, okay, and making or changing wills which already existed. So there are always some indicators which indicates that towards suicidality. Maybe not necessarily that every time we will be able to pick up those indicators, but if we are aware of those indicators and if we are able to pick up and save some life, that's wonderful. That's wonderful.
So you talk about save somebody's life. How does that happen?
See,
because
suicide can definitely be prevented. When I mean to say risk factors, no, if there is a possibility where we can reduce the risk factors, the possibility of suicide also comes down. And one thing is that the suicidal ideations, because of which the person gives into suicide and goes on to commit suicide, those suicidal ideations are not constantly present around the clock. Okay, let's say in 24 hours there could be a couple of times where the suicidal ideations comes. So we need to enable the person to such an extent that he should be able to cope and overcome that particular point of time where the suicidal ideations are at the maximum.
Is that where a psychologist
Exactly. Now I told you, like let's talk about some of the commonest causes for suicide. Okay, the commonest cause for suicide is, let's say, depression or many severe psychiatric illnesses like psychotic illnesses, schizophrenia, severe anxiety disorder, bipolar disorder, along with other risk factors like, let's say, accompanying substance use like intake of alcohol or other substances. They can act as risk factors. Social support, let's say a person is single, unmarried, divorced, separated, and having financial constraints, lack of social support. So these are all indicators which says that the possibility of a person committing suicide or more. So we need to identify those risk factors.